So today's topic, we're going to be talking about, it's all about the eyes, how to enhance your eyes in the era of masks. My name is Dr. Ritvik Mehta at Blue Illusion Beauty here in San Diego. And I think that this is kind of an important topic that, we're all used to wearing these masks at this point. And I thought we'd do a nice session on what can we do about the parts of our face that are actually visible, primarily the eyes. And just to let you know a little bit about myself, my name is Dr. Mehta. I'm a otolaryngologist, head and neck surgeon, and facial plastic surgeon practicing here in San Diego. I went to college here in Southern California at USC, and then the medical school here in San Diego at UCSD. And then I went to Boston, to Harvard, where I did my residency in otolaryngology, head and neck surgery, as well as my fellowship in facial plastic and reconstructive surgery. The nice thing about being in Boston was that I got a chance to spend quite a bit of time at Massachusetts Eye and Ear Infirmary, where not only did I learn from some of the best facial plastic surgeons, but we had a lot of exposure to eye surgeons, and in particular oculoplastic surgeons, during my fellowship in facial plastics. And so that's something that I feel has made me very comfortable working around the eyes and on the eyelids, and that training was truly invaluable. I'm a triple board certified facial plastic surgeon and also a facial nerve specialist. And as I mentioned, I've been in practice in San Diego since 2007. I think one of the things I wanted to say is that, we wanted this to be interactive as well. So if there's anybody that has questions along the way as we go along, there should be a chat or Q&A button at the bottom of your screen. You can type in any questions that you have, and we'll have a chance to answer any questions that might come up as we go along. So feel free to ask anything at all about any of these topics that we're going to talk about today. So I think one of the things that, is important for us to touch on is also, what we're doing currently with the COVID era and kind of what our new reality is. I think that, we've kind of truly embraced this and really plan on continuing all of these new protocols that we've put in place indefinitely. We have a very strict social distancing and sanitation protocol in our office. We screen all of our patients both before as well as on the day of the visit with temperature scans right when they come in. The nice thing about our office also is that we have dedicated consultation rooms for Blue Illusion, so that you're not really waiting in the waiting room at all. You kind of go directly into these consultation rooms that we have dedicated for Blue Illusion, and it really allows a more private one-on-one type of consultation. We use universal precautions and personal protective equipment for all patients, and you'll see me looking like this when you come in to the office. One of the things that I think this COVID era has brought into light is also the value of office-based procedures, which is something that I'm truly passionate about. One of the things that I find, is of great value is being able to treat folks in the outpatient office setting, where we can truly be very strict with, minimal contact, with strictly enforced social distancing and sanitation protocols. We can screen our patients and really avoid general anesthesia and intubation, and avoid hospitals or surgical center facilities, which are often backed up and have quite a bit of backlog anyway at the current time because of delays in other types of procedures. So I think one of the things we talked about in our last webinar last month was the Beauty Lift, which is our office-based face and neck lift, as well as neck liposuction. And certainly that's a webinar available for viewing if you wanted to watch a recording of that. Today, what we're really going to focus on is eyelid surgery, and that's upper and lower eyelid blepharoplasty, or how to improve the look around the eyes to create a more youthful, refreshed, rejuvenated look. And that's something that I will touch on during the rest of this presentation. So in general, my rejuvenation philosophy is that, I sort of have a hyper focus on natural results and avoiding an over-operated look. Really, my focus is to be consistent in my technique, and safety is critical. I truly believe that if it's your face, there really should be zero error, zero risk. And I truly take that to heart in every procedure I do. My focus is on safety. My goal is to create a refreshed and rejuvenated look, not an operated on look. These type of wind tunnel looks or cat eyes really are unnatural and unattractive, and something that we really don't do. As I mentioned, I'm a big proponent of office-based procedures where you can really minimize the downtime, because a lot of the office-based procedures in the face heal much faster. And 90% of facial rejuvenation procedures can be done in the office under local anesthesia without having to go to the hospital or under general anesthesia. And so just like, our academy's slogan is trust your face to a facial plastic surgeon, we truly take that to heart. And I strive my best to achieve a safe, consistent, natural result for my patients. So to talk about the eyelids in particular, I wanted to show you the schematic where you can see that in the upper eyelid, we actually have two fat pockets, the medial fat pad and the lateral fat pad. And in the lower eyelid, there are actually three fat pockets that can bulge and cause fullness in the eyelids. And so, this kind of shows an, advanced pseudo-fat herniation where all three fat pockets in the lower eyelid are significantly hypertrophied. These little dotted lines show kind of where we can actually hide incisions around the eyelids very well. That's one thing that I love about eyelid surgery. The upper eyelid, there's a natural crease that I can truly hide that incision in, so that once it heals, you really can't see it at all. In the lower eyelid, the incision can be right underneath the lash line, where again, it's truly very, very hidden. One of the things I wanted to talk about as we address the eyelids is to talk about the importance of the brow or the eyebrow, which is right next to the eyelids. And one of the things that I find that's important is to look for any brow ptosis or descending of the brow, because that can contribute to hooding in the upper eyelid. We can actually achieve a brow lift, a lateral brow lift with this device called the Endotyne device, which allows me to do an office-based brow lift. So in the traditional kind of brow lift, there can be a big incision in the scalp with sutures. But with the Endotyne, I can make just a small incision on the side and elevate the brow tissue to where I want it to be and secure it. And the nice thing is that the Endotyne device is actually bioabsorbable. So it completely dissolves and goes away. And so that really is something that's very attractive to me, and it allows me to achieve this type of brow lift in the office setting. And I'll show you some examples of this type of lateral hooding or brow issue, so that I can really emphasize to you the importance of that. This is just a patient who actually had facial paralysis on this side, and you can see that the brow has descended quite a bit. This is obviously an exaggerated setting, which is due to his paralysis, but I think it highlights the point that I'm trying to make, which is that the brow can result in a lot of hooding and heaviness in the upper eyelid. And if you don't really address the brow, you can't really address the eyelid fully. And so this is just an example of how correcting that brow just really removes all that heaviness in the eyelid. So that's something that I look for whenever I analyze a patient's eyelids. The blepharoplasty or eyelid lift surgery is something that's done to remove excess skin or excess fat pockets in the upper and the lower eyelids. And again, this just shows, this red line here is kind of where the incisions are hidden in the upper eyelid and in the lower eyelid. And I carefully measure out millimeter by millimeter what is the excess skin, what fat pockets I'm going to remove. And it's a very precise operation for me. I take a lot of effort in measuring out exactly what I'm going to remove. And once I have my markings in place, really that's the key. So I know exactly what is safe to remove and what I need to remove in order to achieve the look that I'm going after. Sometimes, like I mentioned, a brow lift is done at the same time to address any lateral hooding of the upper eyelid. For the lower eyelid, if you have fat pockets in the lower eyelid and not really any extra skin, Then the fat pockets can actually be removed via what's called the transconjunctival technique, where the incision to remove the fat pockets is made just on the inside aspect of the inside aspect of the eyelid. If you have extra skin and if you don't have any fat pockets, the extra skin can actually be removed via one of my favorite procedures, which is just a simple office-based pinch technique where I pinch the extra skin in the lower eyelid and remove it. It's about a 30-minute procedure under local anesthesia, and we can remove any extra skin in the lower eyelid. So this is a patient example of somebody who has, as you can see, a significant amount of hooding in the upper eyelid. The eyelid is not really visible, and removing that extra skin, but also addressing the brow. So, she had a lateral brow lift and an upper eyelid blepharoplasty. And you can see here that the brow is kind of more straight. And then with a little bit of support, we've kind of given a little bit of arch to the brow and also removed that extra skin and hooding so that she just looks more rejuvenated, more awake, more refreshed with those procedures done right here in the office. This is more of an advanced case where, as you saw earlier, significant fat pockets in the lower eyelid, some extra skin in the upper eyelid. Removing those truly makes a big difference and removes all of that bagginess that's underneath the lower eyelid. This is someone who had an upper eyelid blepharoplasty, and this is, again, the upper eyelid blepharoplasty is truly one of my favorite procedures. It's a 45-minute procedure that's done right in the office. And the nice thing, as I mentioned, is that the incision is so well hidden in the natural crease of the upper eyelid, you really can't see it. So all that hooding, you can barely see the eyelid, and we can really remove that extra skin and see the eyelid really nicely and kind of creates a nice soft look to the face, rejuvenates, and takes years off in 45 minutes. And this is a man who had, again, significant excess upper eyelid skin, extra skin in the lower eyelid, and he had an upper eyelid blepharoplasty, but also a lower eyelid pinch just to remove that extra skin. And again, just opens up the eyes, makes him look more refreshed and awake. And this is, again, here is a patient who had an upper eyelid blepharoplasty, and you can see it's that extra skin that we start to see in the upper eyelid. And that's what we're removing. And you can see how nicely you can see that upper eyelid once you remove the extra skin, and it just refreshes and rejuvenates the eyelids. Again, someone else who had upper eyelid blepharoplasty, and you can see that extra skin again, really removing that, allowing us to see the upper eyelid. It really makes a big difference. This is a younger lady who had both upper and lower eyelid blepharoplasty. When you have all four all four eyelids done on each side, we call that a quad blepharoplasty. Again, removing extra skin and fat in the upper eyelid, but also this fat that's in the lower eyelid. When that's removed, it makes a huge difference, as it just makes that whole area, the periocular area, look more rejuvenated. This takes about an hour and a half to do all four eyelids right in the office setting, again under local anesthesia, and removing that extra upper eyelid skin. This is a lady who had a significant amount of upper eyelid skin, camouflaging the upper eyelid, and you can see that just removing that, we can see her eyelids again, and that just makes her look more awake, looks more refreshed, doesn't look as tired, just simply by removing that extra upper eyelid skin. And this is a lady who had, quite a bit of extra upper eyelid skin, as well as lower eyelid fat pockets and skin. And again, she just looked tired because of this. Even after a good night of sleep, she would often have this type of a look. And what we did was simply in the office did a quad blepharoplasty. And again, it just softens up the face and makes her look refreshed, awake, like she went on vacation. But it really doesn't look like she's had surgery. She still looks very natural. And that's really my goal in doing this type of work. Again, what I mentioned, the simplest procedure that we do in the eyelids is the lower eyelid skin pinch blepharoplasty, removing the extra skin in the lower eyelid, which can be done as a simple pinch technique. Local anesthesia, it takes about 30 minutes, and it just makes such a tremendous difference. And it's something that can really smooth out that lower eyelid of crepey skin. She didn't have any fat pockets, really. It was just extra skin, and so that's all we need to remove. It's when you remove fat that doesn't need to be removed, then you can get hollowing in the lower eyelid. And I make a lot of effort to prevent any issues like that by truly analyzing what is the excess and what do we actually need to remove. Is it skin? Is it fat? Is it muscle? What do we need to do? Again, removing extra fat in the lower eyelid really helps the eyes look more awake. And I think that that's something that that I look for. And when somebody presents to me wanting to look more refreshed around their eyes. So, I think if there are any questions, Denise, I'm happy to, take a little pause as we switch gears a little bit.
Sure, we have a question. What's the recovery time for the skin pinch procedure?
Okay, so the question was, what's the recovery time on the skin pinch procedure, which we just did? So the skin pinch procedure, we put in little tiny dissolving stitches in the lower eyelid after the skin is removed, and those dissolve in about a week. So it's pretty quick, usually pretty minimal bruising or swelling, if any, and usually takes about a week or so to recover from it. So it's fairly straightforward to do. So I hope that answers that question. Feel free to type in questions in your chat box or in the Q&A so that we can address them as we pause periodically in the presentation. So one of the things that I wanted to show you this is an exaggerated picture of another patient who was sent to me because of facial paralysis. So she was completely paralyzed on this side. And what I want to show you is a significant amount of extra fat that she had, fat pockets in the lower eyelid. And one of the things, even as she recovered from her facial paralysis, she had significant extra fat pockets. All three compartments were involved in the lower eyelid. And just removing that extra fat in the lower eyelids makes a tremendous difference and flattens that out. And I think that even with facial paralysis, we can get her looking much better and younger just by removing those extra fat pockets. So, it just shows the degree of fat that can be removed in the office setting. This is a lady who had, I get a lot of questions, well, how long does it last? And so this was, an example of somebody who, had come in many years later. We took another set of pictures at almost 7 years from her original surgery. And you can see that, she had, the quad bleph, both upper and lower eyelids done. And even 7 years later, she's looking so much more youthful and refreshed and rejuvenated compared to 7 years prior. And so I think that removing that extra fat in the lower eyelid as well as extra skin in the upper eyelid makes a big difference. There we have it. And again, this is a younger lady who said that, she just has this kind of run in her family where, she's young, she's not truly aging, so to speak, but she gets asked a lot, are you tired? Did you get enough sleep, etc.? And it's because she has this kind of fat pseudo herniation in the lower eyelids, which can be genetic or kind of run in families. And it was quite bothersome to her. So just removing that in an office-based procedure makes a dramatic difference in her lower eyelids. And if she's wearing a mask, you could see that that's what we would see. And she just looks like she's more youthful, more rested once we take that fat pocket out. And again, what we're doing is really removing that fat pocket in the lower eyelid. And you can see how it flattens that out. This is another lady who, had kind of that tired look And she actually had a lateral brow lift and an upper eyelid blepharoplasty just to soften out the eyes. And you can see, I think this is actually 2 or almost 3 years out from her original procedure, and she just looks so much more youthful, refreshed, rejuvenated. Um, she also had some lower face work done. So in full disclosure, she had other things done as well. But just around the eyes, I mean, I think you can see such a nice softening, which I really love because she looks very, very natural. And this is a lady who also had that lateral brow lift and upper eyelid blepharoplasty. Again, you can see the tremendous amount of lateral hooding that she had, because you can see how her brow was kind of straight across and causing some of that heaviness. And you can see how we've gotten a little bit of that arch back to the brow by lifting it up and also showing her eyelids. And so she just looks more youthful and not as tired because that lateral hooding has been addressed. And this is a lady who had lower eyelid blepharoplasty. And again, what we're removing is those fat pockets in the lower eyelid, right in the office setting. And it just, refreshes her lower eyelids. This was a lady who had an upper eyelid blepharoplasty. Again, significant hooding and extra skin in the upper eyelid. And we can finally see her upper eyelid, which makes a dramatic difference. And I think she even said that she just loves how she's able to put mascara on and it doesn't smudge, and she can actually just look better just by being able to do that, because there's actually an eyelid that we can see there. And she just looks refreshed and rejuvenated because of that. This was a man who had, again, I think probably had some genetic predisposition to upper eyelid skin, where sometimes people have upper eyelid skin that just runs in their families. Everybody has droopy eyelids. And he had quite a bit of excess upper eyelid. This is actually all skin. It's a huge skin fold. And removing that, we can finally see his upper eyelid. And so he had all of that removed. Again, like I said, I measure it out. I precisely kind of, millimeter by millimeter, figure out how much we need to remove to achieve the look that I want to achieve. And that's what we're removing. And that's upper eyelid skin, again, being removed. And this is a younger lady who, I like to highlight, and we'll kind of wrap up in a few minutes so that we can take some more questions. But I just wanted to kind of show this because she's a younger, very attractive, young lady, but just had started to get some of that extra skin in the upper eyelid. And once we remove that, you can really see her eyelids, and she just looks more awake and more refreshed. She didn't really need to do anything, but I think you could see what a tremendous difference it makes, just taking that extra bit of upper eyelid skin out. And so I think, if there are any questions as we wrap up, we'll answer some more.
We just have one, like, what is the average age of your patients who do the eye procedures?
Well, the question is about what is the average age of patients. And I think this slide probably just sums it up perfectly, because you could just see it's really a tremendous range of ages. Older patients, younger patients, mild excess. This was the skin pinch lady. So I would say it's anywhere from 30s to 80s. And so it just depends on what the what the configuration of fat and excess skin is, and I will choose to remove what the actual pathology is. And so I think what I'm trying to show here with this slide is that all types of eyelids and fat configurations in the upper and the lower eyelid can be treated with office-based procedures. And really what I try to do is to carefully tailor and customize each client's procedure. And that's what we're really trying to achieve. So in conclusion, office-based eyelid rejuvenation procedures address all types of eyelids like we talked about. My focus is on achieving a natural result, an unoperated on look. And I really try to carefully tailor the procedure. So I'm removing or addressing what really needs to be addressed. And in our current era, you know, we're all wearing masks. We're, you know, kind of what are the things that we're doing specifically around COVID? You know, as I mentioned, we're, you know, very, very strict with our social distancing sanitation protocols. We have aggressive screening procedures. And we really prefer to do office-based procedures because we try to keep people out of hospitals and surgical centers and out of anesthesia, and we can do quite a bit. We're also doing virtual and video consultations to facilitate chatting with folks and avoiding any unnecessary travel. So, you know, come visit us anytime. We're here for you. This is actually one of our procedure rooms where we do the eyelid procedures. You know, I think Shakespeare said the eyes are the window to your soul. It's pretty true. I think we all recognize that, especially as we're wearing our masks. All we see is each other's eyes. And I think that, you know, I'm happy to take any questions, additional questions. There's upcoming webinars as well. I don't know if there's any other.
Does the fat return from the upper and lower eyelids after the surgery?
Okay, that's a good question. I think somebody's just asked if, does the fat return after it's removed from the upper and lower eyelids? And I think that's one of the things, that nice things about the fat pockets around the eyelids is that once you remove them, they tend not to come back. So even as you saw, you know, years later, we see that the fat pockets, and I showed several pictures of people who were several years out from their procedure, where those fat pockets don't really come back. So, you know, removing the right amount of fat at the correct time is a very long-lasting procedure. So we have several upcoming topics coming up as well. We're going to talk about, you know, rhinoplasty, kind of what's the difference between closed versus open procedures. We'll talk about different kinds of fillers and, you know, kind of provide a nice, easy to understand guide. We'll do another session on the beauty lift. And so we'll have lots of seminars coming up. So stay tuned for the next ones. And if you have any questions, call us, email us, text us. We're here for you. Take care, folks.